Kitty's going to explain oxygen saturometry, peripheral lab.
Hello. Not sure why you would need oxygen saturation monitoring outside of a clinical setting. You can usually rely on whether you're feeling short of breath or not as reason to be concerned. If you do have one, if you don't have any underlying respiratory disease, if you have COPD or something like that, your numbers might be, you might be able to tolerate lower numbers because your body would be used to it, say a saturation of 88 to 92, if you had some sort of underlying respiratory condition. But normally you would be 90 and over on room air. It measures the oxygen on hemoglobin. It's certainly probably valid to look at trends. If you were 94 and now you're 84 and you're feeling dyspneic, you probably should go to the hospital.
Dyspneic means short of breath.
Short of breath, yeah. If your respiratory rate is up and you're struggling to breathe, you should always go and get seen.
How accurate is it?
Well, there's things that can make it inaccurate. You know, if you're peripherally shut down, if you're cold, if for some reason it measures through blood flow through your digits. So if there's something that's compromising that, it might not be inaccurate. If you're tremoring, it might not be accurate. But looking at its trend is usually fairly accurate, and we do certainly rely on it. So I don't know if I can give you a percentage of accuracy.
So you don't think it's any use for home use, unless you've got a respiratory illness?
I mean, I think if you're feeling, if your saturations are low,
you're not feeling well anyway.
You're going to feel dyspneic. You're going to feel short of breath anyway.
Yeah.
It might verify that, but I don't know why you would need to do that at home. If you feel short of breath, you can't catch your breath, you're working really hard to breathe, you should go.
But if you have COPD, it's something you could track yourself and maybe give yourself an early warning that you've got an infection rising? Like for people with chronic lung disease?
You could. I mean, I suppose you could. Like I say, I think if you just pay attention to how your body's feeling and how you're feeling,
right,
you'll know.
Right.
You don't necessarily need that to back you up.
All right. Well, thank you very much.
You're welcome.
Bye.
Bye.
So I'm just going down the stairwell. Like I say, I don't recommend you use elevators because people touch them and breathe in them, and if it's viral, it's airborne, even droplet, it's not a good place to be. And I use stairs and take my time. I'm not touching handrails. And if you'll notice, the rings are off, so I can wash my hands effectively. I don't have a wristwatch on. Pretty does, I have to work on it for that. And I wear t-shirts or short sleeves so I can wash effectively. Yeah, and it's actually probably good exercise for me. So when I get to the doors and stuff, I have my dirty hand, and I consciously remember this is dirty until I get to wash it. And there are hand washing stations everywhere, which to use properly, you have to use both hands. And I can't turn the camera off either. So you notice, even though I just had one hand contaminated, I did wash both hands. It's important. And what you really need to do is soap and water under running water as much as you can. These hand sanitizers build up on you, and I don't know if that's healthy. They're better than nothing, and that's what I do. Now I'm going to go into stores. I'm in the basement below ground level from our old hospital, and no surprise, there's nobody here. But I want to check that the supplies are actually in place. Hearing a lot of mixed messages from around the world. My stores people are telling me we're out of a couple types of masks, but it's okay. We have plenty. Let's see how many we have. That's the way to go in. Okay. So, this is our supply of yellow gowns. It's really reduced. It was actually out to here. about 5 days ago. And what are these little things? That's interesting. Large supply of disposable slippers. Unlike American hospitals, we don't actually provide slippers to our patients. Obviously, they want these for another reason. Interesting. Removing shoes, IV stuff, all the usual stuff we have. Okay, so glove supply is looking good. Procedure masks. So these are the surgical type masks. We have a few of these. As you can see, they've already been routed around. They're the masks. I wouldn't advise you wear them. This is new. Surgical gowns. So these are solid surgical gowns that you would wear in a contaminated room. So obviously we've beefed up supplies of them. And a whole bunch of coveralls are new. The isolation masks are up there, small ones. And we do have N95. We've got extra supplies of these. And these are the 821s, so that's good. And over here, it's actually the 16. Yes, yeah, that's good. It's good that we have these. These should fit the smaller type faces because the masks that usually use are out. So we have quite a few supplies, and that's good. And gloves. Now this part's a bit telling. This is actually the masks that we generally would use. These are N95 particulate masks. I'm not really keen on them. But we have obviously had a hit on the mask supply. Now bearing in mind this is Sunday over the weekend, so I would expect supplies to reduce. They're noticeably reduced over normal, and these are additional stuff that's come in over the weekend. So we're ready. Kind of sort of semi-related. This is the MASH casualty trauma cap, and what this has in this is everything we would take to emerge to get them ready to deal with mass traumas. Hand sanitizer. These are the ones that go into the containers, and these are the squirt bottles. We stopped using these, but we've got them again because we ran out of the other ones. So this is what I was on about. I'm actually concerned about this. We have to do a lot more ventilation. Most of the ventilatory circuits, these are OR type circuits, are a little different, but they can be used for ventilation. We don't have a huge stock of that, that's for sure. Hopefully they would work on that if we needed them. Antiviral wipes, massive hit on stocks of them for obvious reasons. I don't expect they're going to last much longer. People are really heavily using these. So this is major dressing sterilised and various OR pieces of equipment and stuff like that. So every so often I come down here to actually get supplies at night that we've run out of and we need urgently. So it's always a good idea for me to know exactly what I'm looking for down here and how the layout is. And I just thought pop down and share the experience with you guys tonight because it's always interesting. You never really want anybody to have to use one of these on you, do you? Not really. There was a time most of this stuff would actually be cleaned and produced in the hospital itself from supplies and reused. Of course now it's all plastic and single use, which is kind of a problem. So what we're planning to use is normal scrubs, which will be changed afterwards, and these are disposable single-use gowns. That's a level 3 gown and that's a level 4 gown, and what we're going to be using is level 4 gowns. And I hope we don't have to use a lot of them because we don't really have a lot of them to take. Well, that's it for me. I'm going to go back to my office and chill out. Says it all really, doesn't it? So yeah, that's it for me. I'm just going to review a little video that I'm watching and tell you what I do. What I've been doing is I've admitted 2 patients into life support and done some staffing issues and done some OR discussions in the last 5 or 10 minutes. Basically my pager goes off, I deal with it. I have a limited number of stuff I actually do because my role isn't supervisory, my role is managerial. So nobody pages me, I don't have any work to do, which is great. But people page me all night long. I'm the only manager in a tertiary care trauma centre in Canada's largest city. And for 12 hours it's just me. So for everything it's me. This has been Bad Terry Production 2020.